morning, everyone. We're calling the meeting to order. We are in sort of a hybrid type of environment ourselves. We're trying to transition back into in-person, and we're trying to work through some of the technological challenges. So today, I am in the boardroom. Dr. Salmon is in her office. Dr. Simpson is here, and then the MSDE officials who are supporting Dr. Salmon are here. Again, we're trying to work through some of these issues so that we can begin to transition to face-to-face meetings ourselves, but like everyone else, it's a process. Again, want to thank you very much for being here today. I'd like to start the meeting today by asking Dr. Simpson to call the roll. Dr. Simpson?
President Crawford, I can do it.
Okay, yes, please. So,
Mr. Crawford?
Present.
General Sumter?
Present.
Ms. Halley?
Present.
Mr. Bartley? Senator Bates?
Present.
Mr. Daschle?
Present.
Dr. Getty?
Present.
Dr. Green?
Present.
Dr. Lee?
Present.
Dr. Melly McCarthy?
Present.
Ms. Morrow?
Present.
Ms. McCusker?
Present.
Dr. Wilcox? And Mr. Wu?
Present. Good morning.
Good morning. Mr. Wu, are you on the phone 02?
Yes, I believe so. I'm calling in this morning.
Very good. Thank you. You have a quorum. You have 12 members present. Mr. Bartley and Dr. Wilcox are not on yet.
is we'll start with our priorities, and then from that we'll move into other business. The other change that we've made is on tomorrow you will note that the executive session has been moved from midway through the meeting into the end of the meeting, and we will come back upon conclusion of the executive session and report out any decisions from the cases and other decisions that we have to make. So again, I'd like to welcome everyone, and at this time, I would like to recognize Dr. Salmon to talk about the call to action and to share some of her thoughts and priorities. Dr. Salmon.
Thank you, President Crawford. Thank you for this opportunity. Before we begin all of our presentations today, which are certainly related to the opening of school, I want to take a few minutes to discuss what I believe is some very crucial information. The success of the path to recovery depends on the actions of all leaders in our state. It's been said that true leaders act during chaotic times, and it's our responsibility as educators to take actions now that will return students gradually and safely to in-person instruction. The stakes could not be higher. A study conducted by Emily Oster, a researcher at Brown University, on almost 200,000 students in 47 states from the last 2 weeks of September, revealed an infection rate of 0.13% among students and 0.24% among staff. That's about 1.3 infections over 2 weeks in a school of 1,000 students, or 2.2 infections over 2 weeks in a group of 1,000 staff. Even in high-risk areas of the country, the student rates were well under 0.5%. The lead researcher on the dashboard, Dr. Emily Oster, has written in The Atlantic and the New York Times about schools not being super spreaders. Her assertions are supported by data, and she is a highly reputable economist and researcher. I actually will have the opportunity to meet with Dr. Oster on Wednesday, along with my chief state school officer colleagues across the nation, to discuss her findings in more detail. In addition to the standard precautions, modeling by Mathematica suggests that by having school in person but limiting student exposure to others, either via a hybrid model or by adding more classes with precautions, wearing masks, eliminating additional mixing of students, and putting 6 feet of distance between desks, most infections from outside the school will produce 0 additional infections in school. 2 new international studies show no consistent relationship between in-person K-12 schooling and the spread of the coronavirus. And a 3rd study from the United States shows no elevated risk to childcare workers who stayed on the job. Combined with anecdotal reports from a number of U.S. states where schools are open, as well as a crowdsourced dashboard of around 2,000 U.S. schools, some medical experts are saying it's time to shift the discussion away from the risks of opening K-12 to the risks of keeping them closed. An estimate from McKinsey and Company suggests that if schools don't return to in-person schooling until January 2021, students could lose between 3 and 11 months of learning, depending on the quality of remote learning. Those losses, it suggests, will disproportionately most affect Black, Hispanic, and low-income students. We know that remote learning cannot replace students' experiences with their teachers, administrators, and support staff. All of the students and educators with whom I have spoken have greatly missed the daily interactions that can only be experienced in classrooms and schools. I believe we must all unite our efforts to maintain equitable learning opportunities and safely return students to their schools. We understand that the number of COVID cases in schools will not be 0, and for some people that means the numbers are not acceptable in terms of returning students to school buildings. But 0 was never a realistic expectation. Even if there was no spread in schools, we'd see some cases because students and teachers can contract the disease outside of school. But the numbers have been small, perhaps smaller than what was forecasted in the initial stages of the pandemic. One might also make the argument that any risk is too great and that schools must be completely safe before local school systems move toward any in-person instruction. But this approach disregards the enormous cost to children of keeping buildings closed. Researcher Yuki Terada writes that schools are the de facto mental health system for many children and adolescents, providing mental health services to 57% of adolescents who need care, according to the authors of a recent study published in JAMA Pediatrics. School closures may be especially disruptive for children of lower-income families, children who are disproportionately likely to receive mental health services exclusively from their schools. The COVID-19 pandemic may worsen existing mental health problems and lead to more cases among children and adolescents because of the unique combination of the public health crisis, social isolation, and economic recession, write the authors of the study. Dr. Danielle Dooley, a medical director at Children's National Hospital in Washington, D.C., told NPR, and I quote, "As a pediatrician, I am really seeing the negative impacts of these school closures on children." She ticked off mental health problems, hunger, obesity due to inactivity, missing routine medical care, and the risk of child abuse, on top of the loss of education. She said going to school is really vital for children. They get their meals in school, their physical activities, their health care, and of course, their education. Adam Rosenberg, the Vice President for Violence Intervention and Prevention at LifeBridge Health, and the Executive Director of the Baltimore Child Abuse Center, said one of the first things they saw in the early weeks of the corona pandemic was the reports of abuse plummeted by more than 70%. But Rosenberg said that's not because the abuse was not happening. Vulnerable people, he said, are even more vulnerable during a crisis, and especially during a pandemic. It's because allies like teachers, coaches, co-workers, neighbors, and family members don't have as much contact and access. When abuse is finally reported, the severity of the abuse, whether it be child abuse or domestic violence, it's much more dramatic than it's ever been before. Maryland local school systems and public agencies serve approximately 160,000 infants, toddlers, young children, and students with disabilities across the state annually. Just over 12% of the school-age population with special education and related services tailored to student needs. Since the beginning of the COVID-19 pandemic, there have been no federal waivers to the provisions of early intervention and special education and related services. Local school systems have been required to implement student IEPs as written or amend them with parent permission or revise them through the IEP team process. Although strides have been made in the implementation of specially designed instruction through alternative service delivery models, the MSD position on face-to-face instruction remains steadfast for all students and especially for our students with disabilities. Students with disabilities benefit the most from face-to-face experiences, especially for those students who require extensive, intensive, and individualized instruction. The task of educating more than 900,000 children within our state is as complex as the world they will face. It requires the combined effort of parents, students, teachers, administrators, the government, business, and stakeholders. At the beginning of the onslaught of the coronavirus and to this day, the education system has had to adapt, innovate, and overcome. I commend everyone for rising to that challenge. Now we must commit ourselves to lead in the same manner to bring students safely back to our classrooms. I believe that we can do this given the metrics and the guidance that's been provided. Rather than focusing on the obstacles that impede the goal, we must focus on solutions that will overcome them. We must put aside partisan politics and agendas and consider our highest priority, which must be the education and safety of students. Our Maryland State Department of Education, myself, and the state board stand ready to work together through continued partnership and collaboration. To date, we are aware that 14 of our local school systems are implementing or will be implementing in November a hybrid model for in-person instruction. The hybrid model in the 14 local school systems are in a variety of forms, and there are many factors upon which decisions are based in each school system. We recognize that moving to a hybrid model places additional responsibilities on our teachers, and we are talking with individual systems to help them look at their needs and how they want to address the needs of their students. We are helping them work through a model that meets their needs and the needs of the students. School systems continue to provide professional learning opportunities for teachers to teach in this model and to provide planning time for the teachers. We will be working with some of our stakeholders in the next few weeks to develop several templates that school systems may consider. Safety is a critical component for all systems as they move forward in bringing students back to school. I also think it's very important for the context of today and tomorrow's discussions to also address some of the conversations that were held at a briefing by the Education, Health, and Environmental Affairs Committee this past Wednesday regarding the return of in-person instruction in schools and recovery efforts to mitigate the virus. During the briefing, there was disappointment expressed by the members of the committee, including the chair and the vice chair, that there was no participation at this briefing from the department. I think I must clarify that neither the State Board nor Maryland State Department of Education were invited to present or to be a part of this briefing in any capacity. Wednesday's briefing was a critical one in which many essential topics were discussed, topics that frequently address the roles of both the State Board and the Maryland State Department of Education in the reopening of schools. It is disappointing to me that an invitation to participate in this critical discussion was not extended to either the Maryland State Board of Education or the Maryland State Department of Education. Unfortunately, all the facts about the various issues that were discussed were not shared, and this led to inaccurate and false statements. Those actions will not help us to achieve what we need to for the children of the state. Continuing to lay blame upon others in order to deflect it from ourselves is not helping the children get back to school. We must work together to get our children back in the classrooms and provide the strong instructional program they all deserve. To that point, I believe that it's prudent to review and provide a frame of reference for some of the statements that were made during the briefing. Concerns were expressed about a dearth of guidance from the state level on several issues of health and safety related to schools opening, particularly surrounding metrics, available PPE, contact tracing, COVID testing, procedures for operating during an identified COVID outbreak in schools, reporting of cases in schools, and finally, the eventual protocol for distribution of vaccine to members of the school community. I want to share some of the facts that were not shared. Many continue to complain that the state has not provided guidance to school systems. This is totally inaccurate. The guidance is there. It must be digested and applied. The State Board issued guidelines for reopening schools with its June 2020 Maryland Together, Maryland's Recovery Plan for Education, COVID-19 response and the path forward, and required local school systems to submit reopening plans to the Maryland State Department of Education for review, comment, and approval. On July 21st, 2020, the Maryland Department of Health and the Maryland State Department of Education issued joint guidance for response to a laboratory-confirmed case of COVID-19 and persons with COVID-19-like illnesses in schools, child care programs, and youth camps. The guidance is designed to expedite notification, isolation, and quarantine of school staff, students, or both, and intended to be used in collaboration between the local school systems and the local health department. The State Board and the Maryland State Department of Education, along with the Maryland Health Department, have guided the local boards in setting the guardrails for reopening to in-person instruction. And the Maryland Department of Health and Maryland State Department of Education released specific guidance and a decision aid on July 23rd that lays out how to identify, isolate, quarantine, and return students and staff that are exhibiting symptoms of COVID-19 or have been exposed to the virus. This document is very specific in how a school should be handling potential exposure to COVID-19. On August 27, 2020, the Maryland Department of Health and the Maryland State Department of Education published joint guidance, COVID-19 guidance for Maryland schools. Within this guidance are health metrics that guide school reopening discussions. It is comprehensive and detailed. These metrics examine the positivity rate and the rate of new cases in a jurisdiction and offer recommendations for a mode of instruction within that framework. For example, if a system is in a county where the positivity rate is greater than 5% and the new case rate is more than 15 per 100,000 residents, the suggestion is to have limited or no in-person programs in schools. Just this past week, Dorchester County Public Schools, in coordination with their local health department, decided to return to fully virtual learning because they exceeded both of the criteria outlined in the metrics. This is an example of the metrics being utilized to inform health-based decisions at the local level. Several school systems have utilized these metrics as conditions improve to begin sending groups of students back into the classroom this school year. Any suggestion that we have not provided health metrics to local school systems is an entirely spurious claim. Moreover, the state board has required revised plans to be due to MSDE after the first school quarter that include plans to return students to in-person instruction. In terms of PPE, we've coordinated with the Maryland Emergency Management Agency and other state agency partners to distribute over 570,000 masks, 162,000 gloves, 17,000 gowns, and 10,000 face shields to local school systems at this point. These supplies are in addition to the PPE already purchased from the local CARES Act funding in local school systems. This effort to enhance the supply of PPE to the local school systems will continue, and as it was mentioned last week at the hearing, no specific number of quantity of PPE has been cited by local school systems as a barrier for reopening schools. In addition, we just found out this week we have another 1.5 million masks coming the way of local school systems and 57,000 bottles of hand sanitizer. We will continue to collaborate and assist local superintendents as they express concerns regarding the issue of PPE. Both the Maryland Department of Health and local health departments are leading the way in terms of contact tracing operations and communicating with school personnel about identifying close contacts. Every set of circumstances with an outbreak is different, and school system personnel should be consulting with their local health departments on whether that particular set of circumstances warrants action for closing a school building for a certain period of time. The health department guidance lays out the information that schools should provide to both the local health department and contacts identified in the tracing operation. School systems should have a system of communication in place where they can be expeditiously notified by parents or staff as they are made aware of possible exposure to or infection with COVID-19. The Maryland Health Department will soon be posting online a summary of COVID-19 outbreaks in both public and non-public schools. The Maryland State Department of Education has been working closely with them on this effort and has had many discussions with them and local superintendents about this. Beginning next week, Deputy Health Director Dr. Jinleen Chan and I will be holding weekly calls with the local superintendents and local health department officers now that the majority of schools are open for some in-person instruction. These calls are in addition to the regular calls that have been conducted throughout the last 7 months with both groups. As far as the strategy for testing, we've been advised that the CDC does not recommend universal testing of all students and staff as a prerequisite for returning to school. CDC guidance, which has been cited by the Maryland Department of Health, notes that a system may consider testing strategies for schools and communities with moderate, higher, and highest risk of transmission and for specific contacts within a school. This is all laid out in the CDC guidance on testing in schools that can be utilized by individual systems to address testing needs in their community. In terms of a plan for vaccine coordination, the governor recently released an initial plan for the distribution of the vaccine once one is available. Conversations are now ongoing between health experts on how best to allocate those resources. The Maryland Health Department and the Maryland State Department of Education will continue to provide updates to the local superintendents as this situation advances. I certainly look forward to the relevant presentations and discussions that we will have over the next 2 days. With that, I'd like to end this part of the meeting with a quote from Dr. Martin Luther King. "If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward." As I said in the beginning of my comments, let's keep moving forward and return students gradually and safely to in-person instruction. The stakes could not be higher. Thank you.
Thank you very much, Dr. Salmon. I'd like to open it up for comments, any comments, reactions from the board before we proceed. I would like to ask you, is it possible maybe next month to get a representative from the health department to come and to meet with us in our December meeting, our next meeting?
Actually, President Crawford, I've already extended the invitation to Dr. Chan, and she's looking forward to coming to the meeting and updating the board on the work that she and I have been doing between the two agencies. And so we'll have that presentation for our December board meeting.
Excellent. Ms. McCusker?
Thank you, Mr. Crawford, and thank you, Dr. Salmon, for your remarks, and which were clearly well researched. I did have a couple of questions and concerns that I wanted to ask about. You mentioned in your speech that districts were providing extra planning time for teachers to prepare for hybrid instruction and to deliver hybrid instruction. I'm currently delivering hybrid instruction. I have been for a week now with approximately 2/3 of our students in our schools during our A and B cohorts, and about 1/3 of our students, the elementary and middle school levels, still taking classes from home virtually 100%. And I can tell you from my personal experience, I do not have more planning time, I have less. The amount of planning time that I had available to me during fully online instruction was more than I currently have now. So I do question that, and I will tell you that teachers are underwater right now, underwater. I worked easily this weekend. I worked easily 16 hours this weekend, making sure that all of my paperwork was caught up, that everything was posted, that I have instruction for both my online and in-person students, which I teach simultaneously. So I do question what districts are providing extra planning time, because certainly mine is not. And the other thing I did want to just address is that we do need to keep in mind that systems are also struggling with ventilation issues, transportation issues, space constraints, and enhanced personnel needs, which they're having trouble meeting. I know that in my district, we are having trouble hiring people into the positions that we need to have everything covered for recess and lunch in classrooms, and having enough substitutes in the building, etc. And it's held up in HR, waiting for paperwork from former employers. And we are also just can't find people. So there are lots of obstacles, but we are still moving forward. And I will say, on a positive note, that students have been happy to come back to classrooms, and we've been happy to welcome them to the classrooms, and have been doing everything we can to make their experience positive ones, and to make sure that the learning is happening as effectively as we can make it, as we are split between two different groups of kids at the same time. Thank you.
Thank you, Ms. McCusker. Any other comments? Ms. Haley, did you want to make a comment?
I move that we affirm the reopening plan that Dr. Salmon has proposed in her comments this morning.
I'd like to second that.
So we have a motion to affirm Dr. Salmon's comments from Ms. Haley, and seconded by Senator Bates. This time, we'll open it up for discussion. Seeing no, I have one, I'm sorry. Dr. Lee, forgive me.
Sorry, I really appreciated, Secretary Salmon, your comments. We did not have the benefit of seeing the comments in advance, so I'm kind of absorbing it as I'm listening. And so sorry for the delayed response, but I am very supportive of the position that I think most of us have, is to really focus on finding ways to reopen the schools fully and not looking for excuses for why we can't. I totally sympathize with what Ms. McCusker has said about the workload. I can tell you many of us have increased workloads because of COVID, and that's just part of the situation. And I think it's up to the local school districts to really find ways to increase support for their teachers. And I see all this money. I don't know how, I mean, it's not a lot of money, $100 million. Seems like a lot, but when you divide it across 24 school districts, it doesn't seem as much, but there are additional resources that I think the local school districts are entitled to use to help their teachers get the support they need. And I have always said there's always been a shortage of teachers in specific topic areas. Every year we get the list. And again, I will rally for offering differential pay to try to recruit the people you need to teach the courses that are under supported, like physics and chemistry and upper level math. The idea that you cannot offer differential pay to try to fill those hard to fill positions. And I think also for recess people, school, support people, the pay is not very high compared to what they can get elsewhere, which it's a market thing. If you can't get people regularly because of the pay, then maybe you should consider finding ways to increase the pay. But I just want to emphasize again that I really support the idea that we really got to move past finding ways to not face the reality. We're going to be living with this for years, and it may not be this. In a couple years, it could be something else. And our plan cannot be to just hide in our homes most of the time. We have to find a way to make the new normal be in the classrooms, and everything is an exception rather than the other way around. So I totally endorse what you said, Secretary Salmon, and I enthusiastically agree to support that position. Thank you.
I'm sorry. Recognize Mr. Bartley, and then we'll then have Mr. DeShield and then Ms. McCusker in that order. Thank you.
Thank you, Secretary Salmon, for all your hard work. I'm going to second the comments of Dr. Lee, and I appreciate your efforts and your well thought out plans and comments. Thank you.
Mr. DeShield?
Yes, I'd like to also affirm Dr. Salmon's comments this morning. I appreciate the position she has taken in regard to returning students to an in-person classroom situation safely. What I find a little disturbing is that there was no representation either from the State Board or from the State Department at the legislative hearing. It seems to me that communication is a key ingredient to positive change. And when we don't have an opportunity to participate and exchange conversation around these critically important topics, I think we do not allow for ourselves to move forward in an appropriate and positive way. So I am disappointed that we were not invited, neither the State Board nor the State Department. It doesn't allow for this exchange of communication that is critically important to the decisions that are being made on behalf of our students. So I affirm, Dr. Salmon, your comments, and hopefully we can move forward consistent with what you've outlined. Thank you.
Thank you. Ms. McCusker?
Thank you. I would just like to clarify that in making my comments about some of the current roadblocks, I want students back in school. All teachers want their students back in school, but we can't just pretend that the roadblocks aren't there either. So I just wanted to clarify, I do want schools to open. We do want our kids there. We just need to have all of the supports in place before we make those moves.
Thank you. Seeing, General Sumter, and then Ms. Morrow, and then Dr. McCarthy, in that order. General?
I'd like to also voice my support for the superintendent, what she and her staff have been doing. Very unusual times, as Dr. Lee said, and finding ways to move forward is what we're all doing. And I know that we speak to the issues, but I'd just like to acknowledge talking to people in the communities, the parents, teachers, superintendents, principals, everyone is moving forward and really trying to do their best. I don't want to forget our support staff in the schools and the bus drivers. It's amazing in the various here and lower shore what those people are doing to make sure our students can return to the classroom. And the dialogue we're having right now helps us understand what each one of those groups is facing and lets us move forward as a group, respectfully helping all those individuals be successful in bringing our students back. And the big shout out goes to the students who locally, just watching them are being so focused on going back to school, but also being caregivers to other students, which has really just heartened me. And I appreciate what everyone is doing, and thank you very much.
Thank you, General. Ms. Morrow?
Thank you, Dr. Salmon, for your remarks this morning. I too agree that we would all love to have students back in buildings, and hope that we can work together as stakeholders, as parents and students and staff, legislators, MSD, everybody, to really keep that moving forward. I did have one point of clarification before we actually vote. Is there anything in these statements that changes what we're already expecting the local districts to do regarding the November reviews? Is there anything that is actually changing, or we're just supporting this statement as a whole?
Dr. Sam?
There's nothing that is changing the board's directions. It's an encouragement to focus on reopening schools. That's why we put out the additional grants. And just to clarify, we've put out $400 million worth of federal funds, and then another amount for the tutoring grant. But it's an encouragement. It is trying to correct some of the inaccurate statements that have been floating around from the hearings about guidance and metrics. We have seen school systems, and I have been in those school systems around the state, watching them reopening and using the guidance. So I can't imagine why we still are hearing that we don't have guidance, because school systems are currently using it to do a really good job right now. And so anyway, it is just an encouragement to move forward rather than to continue to, as a friend of mine used to say, admire the problem. We have to find solutions and move forward. One of the things I did not include in my remarks this morning were the number of emails that I am receiving from parents on a daily basis who are incredibly upset about the virtual learning and the isolation that it is having on their children. I have been sent many pictures of crying children in front of computers. I have been sent videos of people crying with, especially young children, mostly, just really heartfelt concerns from parents about not having in-person instruction, especially for their students with disabilities, and parents trying to jockey their jobs to stay home with their kids. Parents don't have some of the resource that our more affluent parents do to hire tutors and to put children in some kind of a learning pod, which I think is just unbelievable. But anyway, I didn't share those with you. And just yesterday afternoon, as I was finishing these remarks, and I do appreciate, Dr. Lee, that you hadn't had a chance, because I've been thinking about these things for quite a while, and I will provide the board with a copy, and we'll post it online as well today. But as I was trying to finish up my work yesterday, I started getting emails on reopening Maryland education. And in a 15-minute time period, I had about 40 emails of that type, and they continued to come in through the evening, and they are still coming in at this point in time. So I really did want to emphasize and thank you for mentioning the parent perspective, because it is just so incredibly important. People have reached out to me over and over again asking for us to help this situation. So thank you for bringing that up.
Thank you.
Thank you. Thank you. I'd just like to go to Dr. McCarthy, and then, as you know, consistent with Robert's rules, if we have give each person an opportunity to speak 2 times, and then after which we will then take a vote. Dr. McCarthy.
So I too want to laud your leadership on this, Dr. Salmon. I am also disappointed that misinformation has been disseminated despite all of the communication and the work that has been done. I too believe that we can problem solve. This is an opportunity to problem solve. It's not an opportunity to become inert. So I appreciate your comments. I appreciate your leadership, and along with my other board members, I support your comments this morning.
Thank you, Dr. McCarthy. I think I saw, want to go to, let me see if I can, to people that haven't had an opportunity, like to go to Senator Bates, and then to Dr. Green, and then come back to you, Ms. Haley.
I would like to praise Karen also and her staff for the work they're doing. The information we've been given has been just invaluable in trying to help us make decisions. We really appreciate that. I too hear a lot from parents who are very frustrated. They're trying to work with their children. They're also trying to do their jobs, you know, and we've just got to look at education is about the whole person, not just the facts and figures and things that they learn to manipulate. And the socialization is so important for students. They learn a lot. They probably learn as much from each other as they do from their teachers. At least that was the experience when I was teaching. I'm not saying I was a bad teacher, but it was really good the way they shared. And they really miss that in this setting. I'm blessed my grandchildren are in a private school in North Carolina, and they're back in school full time. And it really helps. It encourages the students because they get that support from other students as well. And we've got to take care of those students, or they're going to be way behind. So thank you again, and I'm happy to support your comments. Thank you.
Senator, thank you very much. Dr. Green?
I have to agree with, and I add my voice to Mr. DeShields, and that I think it's unconscionable that no one from your office, Dr. Salmon, or for MSDE, that they weren't invited to the legislative meeting. That to me is really unacceptable. At the same time, I also looked at the reopening plans, the document that we got, and I saw that one of the counties and that has a predominantly minority population is standing fast and not opening until February. I'm thinking all the documents and the research that I have seen have shown that the school closure is affecting our Black and brown children even more so than any other. And the fact that a county that has predominantly, seem like they're just standing fast. I don't know if what we have been saying or what you're saying, Dr. Salmon, is just falling on deaf ears with the local boards. I just feel like our hands are tied, and that we just can't shake somebody at the local level. I'm sure that wouldn't be acceptable, but still, they've got to do this because, our children are suffering. And I don't know for what reason that they're just kind of crossing their arms and stomping their feet and say, no, we're not going to. That is just, to me, that's criminal. Thank you. And I do support you, Dr. Salmon, and what you had said. Thank you.
Thank you, Dr. Green. I think it was Ms. Haley.
I just wanted to respond to Ms. Morrow's question, which part of the reason why I made this motion and why I was so delighted by Dr. Salmon's comments is it's a really emotional time for families, for teachers, for administrators, for the whole system. And I think she grounded the conversation in research. And so that should be a great comfort to all involved, because we don't want to go back emotionally if it's not safe and not in the best interest of our children. And she cited many, many studies that can give us comfort that these are well-informed actions.
I too want to express my support for the statement. If there are no other comments, then I'd like to entertain a vote. If I can get Dr. Simpson to quickly call the roll and take the vote. Those in favor would say aye, and those that oppose would say nay. Dr. Simpson, can you quickly take the roll and the vote?
Yes, are you able to hear me?
Yes, we can hear you.
Okay, great. Mr. Bartley?
Aye.
Ms. Bates?
Aye.
Mr. DeShiel?
Aye.
Dr. Gay?
Aye.
Dr. Green?
Aye.
Ms. Haley?
Aye.
Dr. Lee?
Aye.
Ms. McCusker?
I abstain.
Dr. Lynn McCarthy?
Aye.
Ms. Morrow?
Aye.
General Sumter?
Aye.
Dr. Wilcox? Mr. Wu? Mr. Wu?
Aye.
I'm sorry, was that an aye, Mr. Wu?
Yes.
Okay, thank you. And Mr. Crawford?
Aye.
The vote is complete.
Mr. Schoen?
The motion carried.
Very
Had 12 in favor, 1 abstention, and 1 absent.
At this time, we would like to turn to Dr. Salmon once again concerning the request from the Public Schools Superintendents Association regarding the interscholastic athletics second semester competition season. Dr. Salmon.
Thank you, President Crawford. And I'm going to turn it over to Dr. Lawson to make this presentation. Dr. Lawson?
Thank you, Dr. Salmon. My name is Sylvia Lawson, and I am the Deputy Superintendent for School Effectiveness. At this time, I am going to ask Mr. Andy Warner, the Executive Director of the Maryland Public Secondary School Athletic Association, to display the presentation. Good morning, President Crawford, Vice President Haley, Dr. Salmon, and members of the State Board of Education. The purpose of this agenda item is related to a request by the Public School Superintendents Association of Maryland. A brief background shows the initial steps of engaging students in interscholastic activities began last June with announcements by the Maryland Department of Health and the State Superintendent of Schools. These announcements issued health orders and authorizations for all local school systems to begin in-person athletic conditioning and training for the physical, mental, social, and emotional well-being of students. The importance of these decisions is highlighted in recent studies that show nearly 2/3 of student athletes are experiencing high levels of anxiety and depression. Further steps were taken in June of 2020 by the State Board of Education and the Maryland Public Secondary School Athletic Association. The approved waivers allowed for local systems to maximize participation opportunities through out-of-season participation and flexible seasonal scheduling within defined sports seasons. Per COMAR 13A.06.03, local school systems are required to participate within the defined sports seasons established and need approval of the State Board of Education or the state superintendent to redefine previously established sports seasons. Currently, the MPSSAA has released guidance that provide health and safety measures, as well as requirements to guide each local school system. Individual implementation of in-person interscholastic athletics and extracurricular activities. At the request of the Public School Superintendents Association of Maryland, the state superintendent authorized the MPSSAA to postpone the fall and winter sports seasons on August 3rd, 2020, based on all school systems beginning the academic year with virtual instruction. On August 28th, 2020, the Maryland Department of Health and State Superintendent released updated guidance that included health metrics that further advised the availability of local school systems to return students for in-person programs. These consistent health metrics, allowing for school systems to return students to in-person programs, coupled with the state's move into stage 3 of the recovery plan, paved the way for the state superintendent to restate her June 2020 message, indicating the ability of all school systems to return students to conditioning and training programs, and to authorize the fall high school sports competition season to begin as early as October 7, 2020. The decision to immediately begin in-person engagement in conditioning and skill-based training for any school system not currently operating in-person programs and to begin a fall competition season as of October 7th, 2020 was based on health metrics supplied by the Maryland Department of Health, alignment of the decision with guidance in the MPSSAA return to interscholastic athletics document, the state move into stage 3 of the recovery plan. 22 local systems were under a 4.0 positivity rate, and guidance from the Maryland Department of Health that interscholastic athletic events and gathering could take place. The scale on the left is the statewide metrics, guidelines, and benchmarks issued by the Maryland Department of Health. The scale on the right provides positivity rates on September the 24th, 2020 for each local school system. On September the 24th, 23 school systems were under a 5.0 positivity rate, and 22 school systems were under a 4.0 positivity rate. "13 days later, on October the 7th, the date that the state superintendent authorized that fall high school sports competition seasons could begin fall practice, all 24 school systems were under a 5.0 positivity rate, and 22 school systems were under a 4.0 positivity rate. Given the health metrics, on September the 24th, each local school system was given two options. The first option was for any school system to begin a fall competition season beginning on October 7th, 2020. The second option allowed school systems to utilize the second semester plan, which all 24 local school systems had agreed to on September 11th, 2020, to engage students during the first semester in various forms of conditioning and skill development, and began a competition season on February the 1st, 2021. The Maryland Department of Health issued orders allowing for high school competitions. The MPSSAA has also provided health and safety guidance, and each local school system is required to have a return to play committee. To date, 3 school systems have started fall sports. 15 systems are engaging students through in-person activities, and 6 school systems are currently providing virtual-only engagement. On October the 5th, 2020, 2 days prior to being able to start a high school sports practice, the Superintendent's Association sent a letter requesting the February 1st, 2021 start date be moved up to December 7th, 2020. The State Board is requested to take action on retaining the February 1st, 2021 start date or moving the start date to December 7th, 2020. Thank you for providing us an opportunity to present this information. At this time, we would be happy to answer any questions.
Thank you, Dr. Lawson. If you can take down the PowerPoint so that I can see. It's an opportunity now for board members to ask questions, and after the questioning period, we will then entertain a motion. Board members, any questions? Ms. Haley.
This is a little complicated issue in my mind because I look at the data that says that students could safely participate in a sports program given the guidance of both the department and the health department. And I look at the collaborative work of all of the local school systems, and we always, I think, want to, respond positively when we see that there's a good collaboration going on. When I look at this, I wonder if we aren't going to the lowest common denominator where we could agree to a start date. And so, when I think about, we've done a lot of presentations in the past about equity, and equity was described as if there was a fence and there were 2 students, one was tall, one was short, that you would provide a box for the short student to be able to stand on and look over the fence. And when I look at some of the situations with these differences from school system to school system, it feels like we're saying if all of our children aren't able, or some of our children aren't able to look over the fence, then no one can look over the fence. And that's my concern with the sports situation. We heard some very heart-wrenching testimony from parents in the last session where they had public comment about the impact on our students for a delay in their sports schedules. And this seems like we're going to continue to delay, but I don't really understand why.
Yes, ma'am. I am going to ask Mr. Warner to answer that question. Will you please?
Absolutely. Thank you, Dr. Lawson. The actions by the State Board of Education on June 23rd opened up availabilities for each of our school systems to provide any form of interscholastic athletic engagement as it relates to conditioning practices, even up to having scrimmages if they were not able to offer a competition season there. I think the importance of Dr. Salmon's decision back on September 24th not only allowed 3 school systems to start a competition season and start participation in that, but we have seen 10 school systems start in-person engagement since then, that before that September 24th decision, we're not providing in-person engagement. And that has been actually very exciting to see that we are starting to make those gradual steps forward with getting our students back engaged in person in some form of conditioning and training aspects, because that is one of the steps that needs to take place before you can get into your competition practices at this particular point in time here. This decision or this recommendation from the local superintendent association moves up where their competition date would have been, the last available opportunity to have 3 equitable sports seasons, and provides that at an earlier date if they're allowed to get into that particular position there. But all of our school systems have had the ability since June to provide some form of interaction in person with students in an athletic manner. I hope that answers your question there.
I think it would also be important, Mr. Warner, to indicate the number of school systems that do not have any in-person activity for students right now, and maybe the impact of that December 1st time frame.
Absolutely, Dr. Lawson. So without 6 school systems currently taking the first steps of having the in-person engagement there, that leads to some concerns about those school systems being able to start on December 7th, because we have seen from our other school systems that have started, getting that initial engagement there, understanding how the pods of students will work, understanding the various different administrative preparation things that need to take place in a COVID-19 world. We know there are things that need to take place, and that conditioning time frame is also very important for our student athletes in order for their health and safety over time here. We have seen many studies and reports that have come out showing the need for students to be re-engaged physically, and that there could be health-related injuries that take place if they just jump right back into competition. And so for those school systems, being able to get things in place before December 7th is extremely important if that becomes the date there, because that needs to happen so that they can gradually move into a competition season. And if they are unable to do that, there is a lot of risk for those school systems that cannot move forward to December 7th of having to cancel their basketball or wrestling or indoor track or swimming and diving seasons because they can't meet the new time frame established for a competitive season for winter sports.
Ms. Halen.
I'm sorry, I'm just still confused. So it seems to me we are actually delaying, that we said you could open on October 7th, and we're now having a proposal to move that to December, from October to December. And I realize there'll still be 3 seasons of competition. So that's one question. And my other question is that it sounds like if there are some school systems that haven't let their athletes practice, that all of those school systems that did allow their athletes to practice are stalled because they're waiting for these other school systems to allow their athletes to practice, which doesn't seem right to me. So if you could just clarify those 2 things so I'll make sure I'm understanding correctly.
Mr. Warner?
Absolutely. So the request, answer your first question, the request does not affect the 3 school systems that did start competition beginning on October 7th. They're about to continue with the plans that they have in place that affords greater opportunities for their students to participate in interscholastic athletics. The request revolves around the 21 school systems that did not opt into starting high school sports, a competition season on October 7th. They opted into starting a competition season on February 1st. And their request is to move that February 1st date to December 7th. So it is not a delay for them, but actually their request is to move the date from February 1st to December 7th. In that regard there. You are right with your second question, though. There are 6 school systems that have not started with high school sports currently with any in-person engagement. And so there is concern that they could further delay those, or there's 15 school systems that are waiting for them to get started as well. I think this would be a much easier decision if we saw all of our school systems with some form of in-person engagement right now in that regard.
Thank you.
Thank you.
Dr. Lee, then we're going to, if there are no other questions of the staff, then what I would like to do then would be, if it's a question of the staff, then we'll take this at this time. If it's a question of debating the issue, then I think what we need to do is have a motion, a second, and then a discussion. Dr. Lee.
I have a question for staff.
Yes.
In the memo from Dr. Kelly Griffith, could you please?
If you could mute your phones, your lines, if possible. Thank you.
Okay, question to Mr. Warner on this, in this memo with the table with the modified second semester season, I'm assuming all the years after December 7th refer to 2021, not 2020. And can you clarify, do you know what do you see the memo I'm referring to?
I don't have it in front of me right now, but I do have a copy of that memo, yes.
Okay, so I just want to make sure I understand. So when it says fall, February 13, March 5th, April 7th, is that the fall season that is now going to be played or done during February through April? Is that what this table means? Because it says winter, fall, spring. And I'm assuming all the years are 2021, except for December 7th, 2020. How do I interpret this table?
Yeah, that is correct. The 21 school systems that did not choose to start fall sports on October 7th, they wanted to stay within a 2-semester plan that allowed for them to have 3 equitable sports seasons during the second semester, or in this request, starting December 7th. In order to accomplish that, they wanted to move the fall sports season in between winter and spring sports timeframe there in order to provide that opportunity to the fall sports athletes who have not been able to start high school sports yet. So any dates that should be referenced after January through June should be reflective of 2021 on that memo from the PZAM and the local supervisors of athletics.
Okay, and then a follow-up question of clarification. So if this is the schedule for Maryland, how does that intersect with the schedules in other states? And because I remember hearing and reading all these parent memos about how their kids are disadvantaged because they're trying to apply to college and they don't have playtime in the fall. So if that's still an issue, how is that being addressed and how do other states deal with it? Do you have any comment on that?
Yes, so this aligns, Virginia and Washington, D.C. will be starting 3 sports seasons, Virginia in December and Washington, D.C. in January, and providing a very similar time frame as you see put forward here, 3 sports seasons, winter followed by fall, and then spring sports there. West Virginia and Pennsylvania have been playing their fall sports season since the beginning of September. Delaware is very similar to Maryland right now. They're a couple of weeks ahead of us, but restarted in October with their fall sports season, and then we'll be providing a winter and spring sports season. So they're very similar to the October 7th option Dr. Salmon provided in that regard there. As it relates to some of those different concerns with students not being able to have played and providing film for their colleges and things like that, that is a concern. I have listened to a number of our administrators who know that they have been working with coaches to provide previous year's films, talking to college coaches, anything that they can do to help their students in lieu of actually having a competition season during this fall time frame.
Okay. Thank you. General Sumter.
For staff, the PAM, their letter, I know that 5 jurisdictions did not participate. Were they silent on this or were they opposed?
Mr. Warner?
I was never provided a vote from PZAM on how it was voted. I have only seen the letter from PZAM, which is as much information as you have provided there.
Thank you.
Mr. Bartley?
Yeah, I'm extremely disappointed that the students aren't competing and not playing. I'm a former student athlete, and
Mr. Bartley, let me just say that right at this point here, we're taking questions for staff, if you don't mind.
Well,
and then
I'm gonna give a question.
Okay.
Have you all looked at the private organizations and the examples that they've put forward? So my children are in elementary school and they participate in 2 outdoor sports, and they've been doing so for 2 months now, and nobody has contracted COVID-19. And as a matter of fact, some of the information that I've read is that the spread of COVID-19 during outdoor activities is extremely difficult, is rare, and I have witnessed it with my own children's participation in sports. And so, have you all looked at outside organizations and private organizations and how they're conducting their activities and keeping a low positivity rate? Thanks.
Thank you, sir.
Mr. Warner?
Warner?
So we have been working nonstop since last April with our medical providers, our chair of our medical advisory committee, Dr. Terry McCambridge, as well as a cohort of various other medical professionals. I'm on weekly calls with my counterpart state associations. I have been on calls with the private school associations in Maryland, the MIAA and IAAM, talking about different things that they are doing. We've been sharing various degrees of information between each of them. I've been on calls with all of my counterparts across the country as well. I believe our guidance on July 7th that was put out provides our local school systems with ample information as it relates to participation in sports. The CDC guidance that couples with that provides information in that regard. I will tell you a study from the University of Wisconsin that came out just last week on Friday shows that within 30,000 student athletes, 16,000 practices, and over 4,000 competitive games in September 2020, only one case can be attributed to sports contact in that regard there. This information was shared last week from this recent study that came out as well. And so that is all encouraging news that we continue, as Dr. Lawson shared, the health metrics, Dr. Salmon's decision on September 24th, her decision in June to encourage our local school systems to re-engage students in some form of interscholastic athletic training and physical activity, and then move into our competition seasons. As we've noted, 3 school systems have done so. This request is to have 21 more school systems do so beginning December 7th as compared to February 1st.
Mr. Bartley, I think it is also piggybacking on what Mr. Warner has said. I think it's also important to consider the fact that we do not know the impact the virus will have in our state. We certainly know that cases have been increasing across the country, but that was something that Dr. Salmon and the health department have always considered, and was something that we considered when we provided the 2 options for the school system.
Well, is the start date...
Go ahead, please, Mr. Bartley.
Is the start date for competition... if the start date for competition is based on positivity rate, and Mr. Warner did a great job in articulating the Wisconsin study, doesn't it make sense to get back to competition as soon as possible, since the positivity rate is likely to be really low?
What I would like to do we have a number of items to cover today. So with your permission, what I would like to do would be to entertain a motion. The department has brought forth a request, and that will then, with that, and then with a second, we can then have a further discussion if necessary of the motion. But we have a request from the department. Ms. McCusker.
I would like to move a request that we support the department's request to update the dates for interscholastic athletics.
So moved, Dr. Green.
So we have a motion from Ms. McCusker, and then a second from Dr. Green. At this time, the floor is open for discussion. If there's any additional discussion, Ms. Morrow?
So I looked through the list real quickly, and it looks like of the 5 that didn't sign, 2 of them are Allegheny and Garrett, which are already participating in sports. And so then the other 3 that haven't signed was Baltimore County, Carroll County, and Hartford. By passing this, are we forcing them to start sports earlier than they wanted to? I guess I'm confused. Without any other information from those 3 counties, what does this do to those 3?
Mr. Warner, that would be a good time for you to answer that question, please.
Absolutely, Dr. Salmon. I believe that Baltimore County signed on to a later letter from the supervisors of athletics there. But again, I do not know the vote that took place with BZAM to know how each of the superintendents know. And so from that standpoint, I don't have any information on you of where those local school systems are as it relates to the December 7th date. I do know that those 6 school systems are trying very hard to put together plans to have them approved by their local health department, to have them approved by their local school systems to re-engage students in person. All of our local school systems have been working on that in that regard there. But it does set up the potential for an equity concern here, as noted in the presentation. Without 6 school systems currently engaged in in-person activities right now, that could potentially put them at a disadvantage come December 7th if they're unable to start there, and may force them at some point in time to have to cancel their winter sports season and move forward with the current opportunities that have been available to them since June.
Okay. Thank you. Ms. McCusker?
I just wanted to add that I know Carroll County is putting things in place to begin athletic practices in small groups. I think in the near immediate future, because I have seen as a teacher and a parent, lots of communication coming about that. And I believe Carroll is going to begin their practice stuff. It's imminent.
I can affirm that the superintendent in Carroll County has affirmed that they are signed on to that.
Okay. Any further discussion? Dr. Lee and then Mr. DeShiel.
So I guess my point is that I just don't want this local districts that already started based on earlier statements from the department, to disadvantage them and inhibit what they're doing. So is it possible to sign on to this with the understanding that any of the districts that have already started based on earlier guidance can do what so basically I guess I see this as no later than December to get started. So it's okay for the districts that have already started to keep doing what they're doing and not have to pull back. And I don't understand the virtual participation of the ones that are doing it virtually. To me, it reads like parents are probably doing it, or they're doing informal thing, because any kids that have that type of focus isn't just going to be sitting on the sidelines waiting for this to pass, I doubt. So I guess I'm looking for some understanding about what it means for those schools that have already started. I wouldn't want them to be penalized by us supporting this new thing.
Andy, can you come back on that, please?
Yeah, so the school systems that have started a fall competition season will actually still have a longer winter and spring sports season, and are able to actually give their spring sports student athletes who lost all of last spring an opportunity to have a traditional spring sports season here. And so it was truly beneficial for those 3 school systems who did start, and they would not be negatively penalized by this particular option here. The school systems that are right now providing in-person conditioning or skill development training have taken a step towards getting to a competition season. And so this would provide them with that, able to take the next step into a competition season at whatever that date is, whether it's December 7th or February 1st. our 6 school systems that are in virtual engagement right now are providing mentorship for their students, athletes. They're providing some form of socialization through a virtual engagement with their student athletes there. And for them, they would be able to they need to take the next step into in-person conditioning and skill development training at some point in time, and then move into that competition season as well. This moved up that date on them to say you have it at an earlier date now that you need to get into.
Okay, good. Any other
Mr. Crawford,
additional? Yes.
statement. So I would just like to clarify my feeling on the subject because I have not weighed in, and I want to say that I would have preferred that our systems would have started earlier, given the number of parents that contacted me and contacted Mr. Warner, and the parents that continue to contact because they're frustrated because they can't afford for their students to play club sports, etc. So what I would like to say is that I think it's fine if we approve this. However, I would hope that school systems are going to open on December 7th and that this is not going to be another scenario where we get pushed back again, because those students will count on this. And some of them were counting on October the 7th and then got very disappointed. And I just want to say that I hope that we're going to do this earlier than later. So I just want to put that on the table, because I do remember the vast number of emails I received from parents. And it also goes back to the whole equity discussion that Ms. Haley started at the beginning of this presentation. It is extremely important that we look at this in terms of equity. So that's what I had to say. So thank you for giving me that opportunity.
Thank you. Any additional new comments that we need to have? Mr. DeShield, please.
Yes, I think this is an opportunity for us to support the local superintendent's request. And I know so often we turn to the local school systems for their input and how certain issues should be decided. And here we have a request from the local school superintendents that we do move these dates ahead by a couple of months. And I think it's important to support this request, but I also concur with what Dr. Salmon has just said. If in fact we do move forward and affirm the request, I think it's important for us as a state board to hold to those dates, because once things are established and people begin to make plans and order their schedules around what the state board guidelines are, I think it's important that we keep those guidelines in place so that they won't be disappointed. Thank you.
Thank you. New comments? Any additional new comments, Ms. Haley?
I'm sorry, this is a question because I think I'm still confused. So we are actually considering moving the winter season from a February start to a December start, but we're actually changing our fall season from the recommendation of an October 7th start to a December 7th start. Or no, I'm sorry, to a February start. So one season is being moved back considerably and the other season moved forward. But in the end result, what I think is happening is we are delaying students being involved in sports for a longer period of time. And that's where I'm confused in reading through all this, because I think it's like clear as mud. Because we're trying to talk about seasons as opposed to talking about students just being engaged in sports.
Ms. Haley, I can answer that question for you here. What the request is, the local superintendents association requested a postponement of the fall and winter sports season back on August 3rd for the entire first semester. And at that particular point in time, a plan was put together where we would play our 3 sports seasons, winter, fall, and spring, beginning February 1st, 2021, with 3 equitable sports seasons. Based on the health metrics you were showed today, based on the information that Dr. Lawson and Dr. Salmon spoke about earlier today, there's an opportunity opportunity that was put forward on September 24th to tell our school systems, get students back engaged in person immediately if you haven't already done so, and to provide a fall sports competition season immediately for student athletes beginning October 7th. And 3 of our school systems took advantage of that, while 21 of our school systems stayed with the February 1st plan. They had 2 options at that particular point in time here. In lieu of taking advantage of that, the Superintendent's Association sent a request opening up more opportunities with that February 1st date, moving the winter sports season start date from February 1st to December 7th, and then playing out the other 2 sports seasons immediately following that winter sports season in the second semester plan there. So they have essentially taken their option of starting February 1st and requested to start December 7th in that regard there, because they did not start immediately, as Dr. Salmon had authorized them to. I hope that helps clarify the question there.
Okay, so we're, again, with Robert's rules that we have, give everyone two times on the topic. And I think the question, if there's anything new that we need to discuss, otherwise we have in front of us a request from the department to move the February 1st, 2021 second semester practice to December the 7th of 2020. So that is the motion that we have. Ms. Haley. You are muted.
Okay, sorry. I'd like to offer an amendment to the motion that any school system that is prepared to move forward with the original October 7th authority can do so. So that it's either going to be, December 7th or a time prior to that if they are able to execute that.
Just as a point of clarification, are schools prohibited from starting before December 7th? Yes or no?
Andy?
Are schools prohibited from starting before December 7th? Yes or no?
Yes. They can practice, they can have competition, or they can have conditioning and skill development training, but they're not allowed to start a competition season before December 7th right now.
Okay.
That's not the defined sports season.
Okay. So, Ms. Haley, what you're just trying to understand your amendment will allow them to start these competitions before December 7th? Is that what you're proposing?
I am, only because, again, I'm trying to say we should make progress wherever we're able to make progress. And there were some systems that took advantage of their authority to get their athletes in shape. And we see that some might even lag the December 7th timeframe. There's 6 systems that are still only virtual. So it's going to need to be phased. And I just think we should offer students the opportunities that are available based on their local systems.
Would you restate your motion once more?
My amendment is to say that we would amend the proposal so that any system that wants to start before their first practice date for competition before the December 7th date is able to do so. Because honestly, in the discussion, it sounds to me like there's 6 systems, or some, maybe a couple, maybe it's 3, that aren't going to be able to even do December 7th. They're going to be later than December 7th. Okay. So we're not going to have one date for the whole state.
Okay. So your motion is your amendment is to, a proposal would be to allow the systems to start their seasons before December 7th.
I would, yes, exactly.
Okay. Do we have a second of that?
I second it.
It's Mr. Bartley. Question, Dr. Lee.
I just wanted to also third that, but also simplify it by can't we just say that to start no later than December 7th? So that covers everybody who's wants to start sooner and compete among themselves if they have people they can compete with?
Well, we have a motion on the floor here right now, an amendment. And the amendment is, in effect, to allow them to start before December 7th. Are you proposing different? Because it doesn't sound like it's different.
I was thinking, if I'm understanding the meaning, we're saying that we want the schools to start no later than December 7th, right? Is that what we're saying now? Because before it was October 7th, right? Now it's December 7th, but we don't want to penalize the groups that have already started based on the guidance we gave them back in the end of September.
What the amendment would allow schools to start competition before December 7th. According to Mr. Warner, schools cannot technically start competition before December 7th. So this would allow any of the schools that started early to actually have competition before December 7th. It gives them the flexibility.
Dr. Lee, I think we can't say that no later than December 7th because there are several systems that may not even be able to make the December 7th date based on that they're only doing virtual things now. So we can't force them to start at a certain time. We can just give them permission to start early is the way I understand the situation.
So we have a...
Can I just ask Andy to clarify something, because I think that we're getting a little confused about the sports seasons, and there are some things you can't, I'm going to let Andy explain it, because I think we're going to be out of the controls of what we're allowed to do. So go ahead, Andy.
Thank you, Dr. Salmon. Yes, there's concerns if we don't have defined sports seasons over facility availability. We have schools with only one high school and schools with 28 high schools there. And so if you have different school systems starting at various different times there is the factors of being able to schedule opponents in some of those different areas there in that regard. We have officials concerns. Officials work not only just their individual sports, but they tend to work different sports seasons as well. And so we could get into some issues of not being able to provide accurate number of officials for contests as well if we have our school systems starting different defined sports seasons at various different times throughout the year there. So it's important for us to stay within certain defined sports seasons in that regard. And so this request, I would say that December 7th date is very accurate and is coming from our 21 school system supervisors of athletics who are entrusted by their superintendents there to make athletic administrative decisions on behalf of their particular school system there. And so I think that December 7th sets that defined sports season, allows those logistics to come together appropriately in that regard there. I think what would be encouraging is to have all of our school systems to be doing what they currently have available to them, which is an encouragement to get into conditioning and skill development training leading up to that December 7th date to make sure all of our student athletes are properly in the right condition to enter into competition practices there. I will also say that there is a COMAR regulation that requires 20 calendar days of practice prior to the start of any competitions as well. And so we want to make sure that we don't violate that COMAR rule so that our student athletes have the proper training ahead of their first competitions.
Okay. What I would like to do is bring the amendment to a vote. The amendment from Ms. Haley is that we would effectively allow schools to start their seasons, their competitive seasons, before December 7th. Ms. Haley.
Oh, wait. Okay, so I just want to make sure that I understand Mr. Warner's point. Are you saying that we should say to them prior to December 7th, we strongly encourage a return to conditioning and competition to start on December 7th?
I think that's what the request is from the department to do that. Yes.
Okay, so yeah, my motivation is to get kids back playing sports. So I don't want to further complicate a complicated world. So I would, I'm happy to change my proposed amendment to say that we strongly encourage the return to conditioning immediately and accept the proposed competition schedule starting December 7th. And I assume, Mr. Warner, that if those several school systems that are only doing virtual conditioning don't have the 20 days of conditioning, then they're going to miss a season. Their athletes are going to miss one season.
Correct, but we would allow them to join in at any particular point in time that they can get those 20 calendar days in. So if someone doesn't start till December 14th, then they do their 20 calendar days, we would let them join in at that later date. It just shrinks their competition season. And at some point in time, they're gonna have to come out and say, we have to cancel winter sports because we never got started to that particular point in time.
Okay, so Mr. Crawford, that's my amendment. If someone would second it, I'd like to strongly encourage a return to conditioning for all local school systems, the beginning of the competitive season on December 7th.
Okay. Dr. Wilcox.
I'm sorry, I have a question. I had to join a little late today, and there's just one point of clarification that I need. And that is it up to, do the local districts have, is it up to their discretion, according to local health metrics, to be able to step back if they're noticing an uptick in COVID cases? Can they decide to stop or revise their plan? Or is it once you're going forward, you're going forward? I'm assuming that this is all contingent upon health metrics and data. Is that correct?
Mr. Warner?
Thank you for that question. I believe that the health metrics put out by the Maryland Department of Health, they were shown in the charts in the PowerPoint presentation, show our local school systems how to navigate back and forth there. As the return to interscholastics plan stated back on July 7th, decisions on interscholastic athletics have to mirror, align, and be in collaboration with the educational decisions. These are education-based programs. They are extended learning opportunities that take place after the school day. The same policies and procedures that we're utilizing for school, for education purposes, need to be applied to these programs as well. And so if they're pulling back on in-person programming based on certain health metrics and utilizing the Maryland Department of Health's metrics that are out there, that should be effective of athletics, just like it is with any classroom or hybrid learning situation as well.
Thank you. Any other?
You're saying, oh, I'm sorry.
Please. Yes, please.
So what you're saying is that there are clear health metrics for when to discontinue. Is that correct? Yes. Okay.
Yeah, yes.
Thank you.
Yes, that is correct.
Okay. Dr. Getty.
My understanding of the chart is that the December 7th is not the first competition, that is the first practice date, and that the competition will not start until January, because that is your 20 days of practice that is required, Mr. Warner?
That is the proposal before you from that, and they added some extra days into that 20 calendar days because of winter break. Uncertain of the local school system's winter break decisions to cleaning of facilities during that particular time frame to start right beginning in January there. So they've actually built in an extra week of that practice time frame there for those local school systems to ensure all the precautions, all the necessary things are in place to start having competitions between different geographic areas, where it's not just a one school pod itself doing the practices, but then you start having school A play school B at a different particular point in time.
What I would like to do then is to, I don't think we have a second for, we need a second for Ms. Halley's revised.
Seconded.
Senator Bates, good.
Yes.
So yes, Dr. Lee.
Can I ask a question of clarification? So what happens if this motion doesn't pass? Is the alternative that we're still left with October 7th as the start date that was allowed? Can you just clarify what the options really are?
The options would be to currently do the second semester plan, which would start in February. Only 3 systems started in October, so the rest would start in February.
Okay.
All right. Let's now at this time take a vote on the amendment, which would strongly encourage conditioning in all of the local systems to start now. Encourage them to do it now. What I'd like to do is to ask Dr. Simpson to quickly take a vote on the amendment, and then after the amendment has been disposed of, we will then come back to the motion to accept the recommendation from the department with respect to a December 7th, first practice, December 7th, 2020. So, Dr. Simpson, can you quickly take a roll call? This is on the amendment to strongly encourage conditioning for all of the schools to start now.
Mr. Bartley?
Aye.
Ms. Bates?
Aye.
Mr. DeShields?
Aye.
Dr. Getty?
Aye.
Dr. Green?
Aye.
Ms. Haley?
Aye.
Dr. Lee?
Aye.
Ms. McCusker?
No.
Dr. Millie McCarthy?
Aye.
Ms. Morrow?
No.
General Sumter? General Sumter? General Sumter, I can see you, but I can't hear you. What is your vote?
Aye.
Thank you.
My vote is up.
Dr. Wilcox?
Aye.
Mr. Wu? Mr. Wu? Mr. Crawford?
Aye.
The amendment carried.
Okay. So the amendment has carried. We're now going back to the original request from the department. There's a motion on the floor to accept the department's request with respect to a December 7th first practice date of December 7th. At this time, what I'd like to do is to have Dr. Simpson again take a quick roll call vote on this. Dr. Simpson, if you would help us.
Mr. Bartley? Mr. Bartley?
Aye.
Oh, thank you.
Sorry.
Ms. Bates?
Aye.
Mr. DeShields?
Aye.
Dr. Getty?
Aye.
Dr. Green?
Aye.
Ms. Haley?
Aye.
Dr. Lee?
Aye.
Ms. McCusker?
Aye.
Dr. Millie McCarthy?
Aye.
Ms. Morrow?
Aye.
General Sumter?
Aye.
Dr. Wilcox?
Aye.
Mr. Wu? Mr. Crawford?
Aye.
The motion carried.
Very good. I'd like to turn to, let me just see. Let's, we have still a number of things to do, but I think it'd be in order to take a short break, give everyone a short break. Can we do like 7 minutes or so? Is that possible? So that we can return? Okay. So we'll take a 7-minute break and start promptly. Ask everyone to be back in their seats in 7 minutes. Thank you. Okay, we're about ready to reconvene. Welcome everybody back. Very important topics. Glad we're taking our time and working through them. Okay. And let's just see. We're going to go ahead and get started. Again, we're going to turn to Dr. Salmon to talk to us about the Maryland's recovery plan and an update on the reopening plans and the dashboard scorecard. This is again, as we look at the purpose for having a dashboard process is really to try to create as much transparency. I know there were questions raised about whether it's safe and how things going. A dashboard allows you to quickly begin to answer some of those key questions. The challenge with putting together a dashboard is having to work through the right metrics. So this is the first of a conversation. We're going to start by having this superintendent share with us what we have, and as we go through it, if there are some additional measures, I think one of our board members mentioned ventilation. We've heard that as we've talked to some of our stakeholders, so maybe there's some additions that need to be made. And also recognize that some of the metrics might be readily available, some might require some work and some time to try to figure out how we would do that. At this time, I'd like to now turn the discussion over to Dr. Salmon.
Well, thank you, President Crawford. You did a very nice cue set for the next session, so I don't know that I need to do much more except to say that it is extremely difficult to decide what are the appropriate things that should be here. So what we've done is to take a lot of different things that have been suggested, and you'll see that later in the presentation. We want to give you an update on what's currently going on, as we have been doing every month in the schools. And again, I'm happy to report that I've been able to be out and about, and look forward to a visit to Wicomico County this Friday. So we are going to give you that overview, and then we'll look at this dashboard concept. And we put a lot of stuff in there. It's got a lot of things in there, including some of the things you just mentioned, but also it includes the first term metrics that we discussed earlier with the board, and we're going to review those again too. So I'm going to turn this over to Dr. Williamson, and I also want to take the opportunity to thank Dr. Williamson, Dr. Lawson, and Mary Gable for their continued work on this reopening plan. They have formed a weekend collaboration. I think they work every Sunday together, and so we appreciate them working over and beyond the number of hours that they normally work, which is a lot. So I'm going to start with Dr. Williamson, and then we'll move on to Mary. So thank you, Dr. Williamson.
Okay, thank you, Dr. Salmon and Mr. Crawford, because you both did a great cue set for me. And I may be repeating a little bit of what you just heard, but maybe it'll help to help the other board members formulate what it is that we're about today. So I am Carol Williamson, Deputy State Superintendent for the Office of Teaching and Learning, and I'd like to provide you with some background information on this presentation. As we have for the last several months, Dr. Lawson, Mrs. Gable, and I
have continued to provide you with our most updated information regarding when students are returning to face-to-face instruction in each of our school systems. I want to point out that we are seeing many versions of this information published in other venues, and most likely individuals are gathering it from what's believed to be up-to-date sources, and then they produce a chart to share with their audience. And I'm only mentioning this to you because I want you to be aware that sometimes you'll see charts and wonder why they're not the same as our chart. And what I will say to you is that we have made it an effort to keep our superintendents and our school systems aware of it. If they will keep us apprised of when they make changes in their plans for their system, and that happens regularly as they get new information, that we would make sure you have that most up-to-date information. And so at our October 13th Assistant Superintendent's meeting, we were able to ask them to send us exactly where they are in terms of bringing students back. And that's what Mrs. Gable will be reviewing for you, and that's what's in the information that you received in the report packet. Then the majority of our presentation today is going to be devoted to a discussion of a data dashboard. And if you recall, following a presentation from the National Association of Boards of Education at the September board meeting, you as a board indicated you wanted to focus on identifying some data points and then review relevant data and available data at the beginning of each of the board meetings. So Dr. Lawson, Mrs. Gable, and I were asked to create a dashboard that would focus on identified data points, noting school system readiness to return students to classrooms and to face-to-face instruction. We were provided a model of a dashboard and asked to develop a Maryland dashboard that would show how we're doing as a state. And we were asked to think about how we might measure those items. The thought was to identify areas in which systems might need support so that energies could be directed to those areas. We utilized the recovery plan rubric and set it up according to the model that we were provided. And those indicators that would aid in identifying readiness to return were placed down the left side of the dashboard. And they were defined, and then a rating was established for each data point. We were also asked to include on the dashboard some of the areas from our first quarter metrics, and we were able to do that. And you will have an opportunity to see those metrics that could be included and to hear how those that didn't fit onto the dashboard will be handled. And finally, it was suggested that there be a scorecard for each school system that reflects each of the data points on the dashboard. If possible, each month, systems would provide data on each data point, and it would be available for the board to review. You'll have an opportunity to see what that would look like, and you saw that in your packet. It's the final packet in this little section for the presentation. So before I turn the presentation over to Mrs. Gable, I just wanted to mention that today is an opportunity, as Mr. Crawford said, for you, the board, to review each of the indicators and determine if you agree with them, wish to modify any of them, or eliminate some of them. And you should be thinking of the purpose of utilizing this dashboard and scorecard, and determine if it will help you accomplish your board priorities and if it will be of value in terms of improving instruction for students. So with that, I'm going to turn the presentation over to Mrs. Gable.
Thank you, Dr. Williamson. I hope that you are seeing the PowerPoint.
We are.
Thank you. That's great. So first off, as Dr. Salmon said earlier, just a summary. The summary that you see before you is October 13th, and we're constantly looking at the school systems and their plans and their announcements by superintendents, by their local boards. And overall, we would say that we have 14 school systems that have either started hybrid or will be starting hybrid in the month of November. They are generally starting with the younger students, elementary school, but many have started and some have started with middle schools, and also some with high schools. In particular, they're looking at some of the CTE programs in the different school systems have opened. There is one, as you know, that was hybrid, went back to virtual, and that school system is taking a look at their numbers And there are 7 school systems that are still bringing in, as you see on the slide, they are bringing in small groups of students, and they're listed there. We've mentioned this before to you. And then there are 3 school systems that we understand that at this point are still virtual. The next slide that I'd like to show you are the list of the school systems. You have this in paper copy and also on the screen. This, as Dr. Williamson mentioned, is as of the assistant superintendent's meeting on 10/13. They all come together, and one of the questions was, where are you now? What are your return dates? So there's the general summary that I gave, but in particular, you can go through each school system based on the information we received to see where they are. You'll notice some school systems give us dates, a variety of dates, because that goes with what I previously mentioned, that some are phasing in different. You see in Anne Arundel talking about pre-K to 2 on the 16th of November, followed by grades 3 to 5. The next slide and the next few slides are the data, again, that we have collected by the local school systems. And as I've mentioned, some are more specific than others, but that's the data we received, and we are trying to reflect the school systems as best we can for you, so we can share with other stakeholders that are listening and reviewing the state board meetings. We also included the Maryland School for the Blind this time. That assistant superintendent attends the assistant superintendent meetings and provided us with information that was happening at the Maryland School for the Blind. So that is the information that we have, and I believe that for the past few months we have continued to update you and will continue to do so as we move forward and as we are always gathering the most up-to-date information. The next is the dashboard scorecard. This is what Mr. Crawford, Dr. Salmon, and Dr. Williamson have referred to. What I'd like to do for you is just walk you through what is in the scorecard. I know that some of the print is going to get smaller because it's a hard job to take something that is relatively small on an 8.5 by 11 and get it on a slide. But we put it here so we can walk through it. You also have the hard copy, which has the full slides in front of you. I want to call your attention across the top. This is a sample, and when the whole scorecard is put together, you will see a column for every local school system. For the purpose of size, I've included Allegheny and Anne Arundel, and where it says remaining school systems, there would be one for each school system, the next being Baltimore City, Baltimore County, and so on, for all 24 school systems. On the left are the topics, and the topics are in bold, and then the subtopics are not in bold. I've only given you one sample, and this sample was probably, we submit the documentation to you, as you know, at least we submit it a week before, as much as a week before your state board meeting. As of the date that I was collecting this, the positivity rate, 7-day average for Allegheny was 4.03, and on that date, it was 3.16 for Anne Arundel County. We have included a legend for you. We were asked to include, is it green, meaning moving positively, and you've talked a lot this morning about moving forward. Yellow, or is it red, meaning a stop, or perhaps not as moving forward as other systems. This is just one line sample. As we collect the data, following your review and your recommendations for any revision, once this data is uploaded by what we've collected from the local school system, what they've entered, however we enter this, and it might be different for different metrics, we will add a color so it could be more visible, or you can take a look at the numbers, and we have a recommended green, yellow, red for percentage review. So the only sample you have is infection rate, but there would be others as it was completed. The next item that you have before you is safety protocols. We looked at 3 items, and again, as Mr. Crawford, Ms. Haley know, a number of these you provided to us. We've added. We may have had to take out a couple because we didn't think we could provide that for you, but we've also added quite a few numbers. So first is isolation facility. It is recommended that every school have a separate room, and I'm not going to go through each one, but I'll just give you a sample. It is in our guidance. It's in the guidance from the Maryland Department of Health that every school have an isolation room should they have a student who is thought to potentially have the virus, that student can be isolated. It doesn't have to be in the health suite because it may not be possible because it doesn't exist in that school building, but there is another space that school would identify. Compliant cleaning protocol. Is a school, what percentage of schools have the supplies necessary to keep the school clean? And the third one is the daily room cleaning, and that's what percentage of schools the percentage of schools with used classrooms cleaned daily. And I'm going to walk you through this, and then I'm going to, if that's okay with you, come back so that you first get a sense of the whole picture, and then we'll come back and discuss them as we move forward. The next set is PPE for classrooms, and Dr. Salmon mentioned in her initial comments about the masks that have been received, gloves, and also masks, and in particular right now, hand sanitizers that we have been notified that are being sent or we've already received and will be distributing. So it's the percent of schools with masks available, gloves available, hand sanitizers available.
Can I just interject something, because I don't want folks to think that the only PPE that school systems have is what we've distributed. That's in addition to what they have already purchased through their CARES Act money. And I will mention that all of the schools that I have visited so far have shown that they have the appropriate PPE. And I've given examples in prior board meetings about how it's located and how they're handling it, but they do have PPE. And I just wanted to make sure folks weren't thinking that this amount was all that they have. Thank you.
Thank you. Thank you, Dr. Salmon. The next topic is survey regarding students. Question is, what percent of schools, school system would be answering, what percent of schools where the teacher and the student are physically present for instruction? And then it goes on to face-to-face instruction with the teacher for designated groups, instruction face-to-face or instruction with the teacher in a hybrid model, and then what percent students that are 100% virtual instruction. The next is the percent of teachers in the building. So there are questions about students and there are questions about teachers. The percent of teachers in the school building with face-to-face instruction every day, 100% virtually, 100% virtually from the home, and teachers in the school building face-to-face and teaching students virtually simultaneously. So we've heard about that with the hybrid. The next question was about equity, and we defined equity by, does a student have a device? And 2, does a student able to have connectivity in order to be able to access that instruction? You spoke a lot about athletics this morning and took a vote on the date. So the questions that we created, obviously prior to this, was every system was required to have a return to play committee, and it should be meeting monthly. Return to play October 7th or second semester. We can revise that now based on the decision of the state board this morning. The percentage of students currently interscholastic competition in person and in person for conditioning and skill development, and currently virtual engagement for athletics. Again, we can adjust these based on the decision of the state board this morning. The next set of items, those are basically the set of items that we looked at originally with the dashboard and the scorecard. But then we looked at I just realized our lights go out. I realized I was sitting in the dark, so I'll move my arm to get my light back on. The next is the first term performance metrics, and you have heard and seen these a couple of times. Dr. Shaw has reviewed these. The first term performance metrics are actually in 3 categories. The first category are the recovery plan performance measures. The second are the start of the year The second are the start of the year student diagnostic based on the assessment, how are students doing? And the third, I have on my paper here, the third are more open-ended questions, specifically implementation narrative, what described the way the system has implemented the recovery plan's process to accelerate learning, and so on. And there are, I believe, actually 5 questions in that section. We reviewed those 3 sections of the first term performance metrics and determined that the first section, the recovery plan performance measures, were more in line and lent themselves to the scorecard. The other 2, extremely important. You will get that data, you will get that information, but it will be delivered, our recommendation is it delivered in the way it was originally planned and not as part of the scorecard. So some of these are very similar to the questions that we've asked, but we did review these. And so each of the performance measures are listed here. And so the first one that you've seen before, how many instructional days has online distance been available to students, and express it as a percentage of 45 instructional days. Why 45? And that is, we have 180 days in a school year. That means 90 days in a semester, and therefore first marking period is 45 days, second marking period 45 days, and they go out. So express that in a percentage of 45 days, which gives every school system the same number that we're working from. And then there are a variety of questions that have been part of those measures. And we'll skip around a little bit. In a typical week, what is the average daily amount of time for synchronous instruction, averaged across all grade levels? On September 1st, the state board made a decision to take a look at that average daily amount of synchronous hours and posted those 5 or 6 decisions. What percent of teachers and principals have received training on effective distance learning practices? We've been sharing the professional development, the professional learning, the training that has been going on really since last spring, certainly very intense through the summer and continues through the fall semester. We've talked many times about attendance during first marking period is another example. What was the percent of attendance for the entire school system? The next ones in the attendance during the first marking period, what was the percent of attendance? We've asked this to be disaggregated by school and by student group. So you see that question broken down. We did it by elementary, middle, high, and combined grades. And we have done that for each of the questions that are part of the dashboard. I think in your hard copy, I will refer to you that, and if you take a look at the hard copy, specifically as you work through on the questions. Question number 47 on your hard copy is during the first marking period, what was the percent attendance? And you can see that work through for each of the disaggregated groups. And so we have listed all of that for you on there and on the PowerPoint. With that, I know, Mr. Crawford, you frequently asked to take the scorecard down. I am going to go back to the first part, the infection rate, the safety protocols, provide that to you and do it in whatever way you want. But at this time, we offer you this set, this model, this dashboard, the dashboard meaning kind of the cover, but the scorecard for each school system that we would be collecting, and offer this for your discussion and recommendations on the metric and also the legend of green, yellow, red. And I will turn it over to, I don't know if Dr. Williamson has anything else to add, or Dr. Salmon, and I'll turn it over to for discussion.
The only thing I would add is that I think it really is important. We have to consider several things as we look at this. First of all, you heard us say that it would have to be the schools that would give us this information. So what's going to be possible for them to be able to turn around and give us on a regular basis? And then we will have to compile that if we're looking at doing this monthly. So I think you need to think about which things would be important for you to have monthly. And then if all of these things are pieces that you feel are critical to accomplishing what you are setting out as your priorities. I think, Mr. Crawford, you mentioned that at the beginning, but we were interested in seeing some data at the beginning of each of our board meetings.
Okay. Well, thank you very much. I think this was an excellent start. I'd like to open it up for comments and questions, areas. I think appreciate everything that Ms. Gable and Dr. Williamson and others have done. We have to be cognizant of an important point, and that is that we need to have good data so that we can share it, we can see it ourselves, but also the transparency so that parents and other interested parties across the state would have it as well. We also need to figure out what are the critical things. So we could report 1,000 indicators, but the burden would be so much and it would be hard for us to even manage. So figuring out the right ones. I think to do this and to do this properly, one of the critical things that people are going to look at is how do we respond to yellows and reds? And do we then jump out there and punish people because it's yellows or red? Or do we rally the resources of the department, the board, the community to try to help find solutions, that may require the board to become more, from time to time, to take on a bully pulpit, to advocate different positions on behalf of the local school systems, on behalf of the department. But let me now just open this up for comments. If there are some measures that you think we should have that we don't have, if you think there's some measures that we've got that don't seem to be quite as important, we'd love to have your feedback, and we will continue to refine this. The challenge again is figuring out the right measures. If we can open this up so that we can see everyone and then be in a position to take questions or comments. So if you could take down the PowerPoint so that we can see everyone. Okay. All righty. Let me now just open it up to comments. Dr. Wilcox, and then Ms. Morrow and Ms. McCusker. So we'll start there. Please.
Thank you so much for putting this together. And one quick question was, in terms of the safety protocol section, I wonder if it should also include a protocol or plan for COVID testing.
President Crawford, can I speak to that?
Please.
So, Dr. Wilcox, a great thing that kind of seems like it's left out. However, I do think that testing is under the Maryland Health Department, and that protocol is being worked on right now with Dr. Chan and her health officers. According to as I stated, the governor has a number of tests that will be put out to different cadres of folks depending on the most critical needs first for testing. And then Dr. Chan and I have most recently discussed, as of last Thursday, the use of testing in schools would probably be more limited to symptomatic cases in schools, because even though these tests are the rapid tests, they still require health training. A health practitioner, for the most part, needs to be administering these assessments. And we see that as happening in the school wellness centers or health centers, again, on a symptomatic basis, because we do not have enough tests to test everybody every day, which is what you would have to do in those cases if you're using it as a screening device. So I would rather wait for them to come out with their protocols before we add it to any kind of a scorecard, because I do feel that it's really under their purview, and the CDC does not recommend that we push testing in the schools at this point in time. Until that changes, I'd rather hold to the health department being in charge of that.
Thank you.
Dr. Wilcox. So is it Ms. Morrow and then Ms. McCusker?
Thank you. Okay, so I have three questions that I'll try to answer quick or ask quick. First of all, were local school systems able to provide any input on this chart yet? Second of all, I see we have items for athletics. Do we want to have an item that includes like band and your other activities to reflect whether those opportunities are in person? And then third question, and I'm looking at the spreadsheet that has the numbers next to the items. Number 42, or line 42, it says, in a typical week, what is the average daily amount of time for synchronous instruction? This is a question I've asked previously. How are we incorporating the fact that some systems are hybrid, so some of that time is synchronous, some of that time is live in person, and some people are still 100% virtual, even within the same district? So how are we averaging all of that time together for this line, or is that really just focused on the kids that are 100% virtual?
So all good questions, Lori, and or Ms. Morrow, I'm going to turn that back over to Dr. Williamson to answer. I just want to refer us back to her comment about wanting to put too much in here that we need to be monitoring and asking school systems to report. I'm not sure that we want to go into, each of the extracurricular activities. The reason sports was on there is because that was the, issue that we were having coming before the board on a repeated fashion, as in today. But I'm going to turn it over to Dr. Williamson to talk about how we would be calculating that synchronous learning. And it also gives me an opportunity to make one statement, and that is there are so many different varieties of synchronous and asynchronous learning. We have those terms were not available to us 7 months ago. I didn't even know what that was, to tell you the truth, until someone started using them. And we do need to do a really good job of defining them, because what I have seen on my school visits is very innovative. In some cases, we have teachers, as Ms. McCusker was talking about earlier this morning, who are teaching simultaneously to half their students at home and half their students in person. And so that is one way that people are doing it. We then have other systems that are only teaching separately those two cadres. They're not doing it simultaneously. So the thing we have to be really careful about is defining our terms to make sure everybody has that same picture in their mind about what's synchronous and what's asynchronous, what's happening on the days that are cleaning in schools and people are not in schools. Teachers are on virtual, but are they still teaching in terms of online synchronously? So we have to be really transparent. So you've made two really good points. Now I'll stop talking and turn it over to Dr. Williamson to answer the, how are we figuring this out part?
Well, Dr. Salmon, I think you answered it. You answered what I would have answered, and you mentioned it in your opening remarks today, that each system's a little bit different, so it really depends on how they're organized. So we have been talking with the individual school systems. So an example would be what you said, which is they might be set up so they're teaching their virtual students at the same time they're teaching their students that are in class in front of them. And so, as Ms. McCusker knows, because I was an elementary teacher as well, and we're used to working with small groups, you can have your in-class students be working on an assignment, and you can turn and do something with your other students in a small group if you wanted to. But we look at the in-class students as being fully synchronous. So we would probably count all those hours as 12 hours if it was 2 days. And then we have a Wednesday, which is often a changeover day. And then we have Thursday, Friday. And in some school systems, because they were doing synchronous with both groups, they have counted their synchronous hours across all those days. But in some systems, they are looking at asynchronous on the 2 days. And so then they are looking at how they are picking up their synchronous hours on the Wednesday. It depends on how they want to organize and what the needs of their system are. And I think we're going to put out a variety of models so that people, and I think they really do have to talk through what they're having their teachers do. Mary also talked with a county that was the AABD. She might want to explain what they ended up with, but each one of the ones we've talked with has been a little bit different, just in terms of what their needs are. And I think they have worked satisfactorily with each of them.
We're very
flexible.
Appreciative of, yes, I think that's a great word, very flexible. I mean, it doesn't have to be one way or the other, just so we're getting students in the schools for some in-person instruction and also giving them the opportunity to learn on those days synchronously that they're remote. However they parse it out, we'll be supportive and provide as much technical assistance as we can, but we really do want to be flexible, but we also want to make sure that we're all talking about similar things when we discuss something, because there's a lot of misnomers out there about, what these terms mean. So thank you.
And Mary, you're going to give your example?
Yeah, I'd be happy to. And I also want to say that Dr. Shaw is doing technical assistance on this. So she has been working with the assistant superintendents, all 24 of them, and others in the training and the answering questions and been providing technical assistance so that to try to help. And then in response to your question, I did speak to one of the school systems that they are bringing in what they call was an AABB schedule. So students come Monday and Tuesday, half of them. Let's use an example of a classroom. There are 12 students that they can fit in the classroom. The other students are at home. The teacher is, as you've described, teaching virtually to those that are home and also teaching face-to-face to the students in the classroom and doing that simultaneously. They've worked out the day in blocks of 2 hours, 2 hours, 2 hours, 2 hours, so that they're alternating what is happening for the children. It's not a straight same thing all day. They then do the same thing on Thursday and Friday, but they flip and bring the other half of students in. Same model, support to the students face-to-face or synchronous instruction. And on Wednesday, it is a 100% virtual day. Half of that, however, approximately 3.5 hours, is asynchronous learning. So there's direct instruction happening each of the 5 days. And this was, it's really nice to have a conversation and help think through and understand the complications that school systems are doing, and that was with Anne Arundel. And it's far more detailed than that than I've just given you, but that's an overview.
And then the first part of my question was, has this already been kind of discussed in the superintendent's meetings, or were the local districts provided any input on this before it came to us?
The only thing I would say in reference to
Carol,
that.
I can answer that.
Right.
Sorry, I thought I was unmuted. So we have had a couple of conversations about the fact that the board wanted to do something with the dashboard. I gave the superintendent some examples on a call last Friday, but we did not have the document completed by then. So my hope is that we could send it out, and I don't know what the board's pleasure is, but my idea was being able, after we got your feedback, to send it out, and then we would continue to work on the areas that you want in there and get their input as well. We just weren't quite ready to have it all together. So I think it was the board leadership's pleasure that we would put it out there after we got your input on it. Is that correct, President Crawford?
Yes, absolutely.
Okay, thank you for the clarification.
All right. Ms. McCusker, Senator Bates, and then Dr. Lee.
Thank you, and thank you very much for the effort that went into this. I am sure that this took you guys just hours to pull together and put together. I kind of share Mr. Crawford's concern that with the term scorecard and saying that if you do have something that is red or yellow, that we don't want this to be a gotcha kind of thing. I look at the dashboard more as an informational document than a scorecard. So I have a little bit of concern with the use of the term scorecard, although I think the more information is more transparent we are, that helps families and understand what's going on in their school systems and their level of readiness. There were a few things, couple of things in the categories that I had concern or question about, particularly if we're going to use it in a scorecard kind of thing, because there were a few things that seemed to be sort of out of the control of the local school systems. For example, when we talked about the student portion under survey and students, in some of the counties, well, in most of them, families can completely opt out of some of the in-person options. And so if we're scoring a county as red because only a certain percentage of students, families have opted to come back, it looks like, because it's red, that it's a bad thing that they're being penalized for something that really wasn't their choice, it was a family's choice. So I had a little bit of concern for those things that really were like the percentage of students who are physically present when they can opt out. Another place was when we talked about the percentage of teachers that are teaching virtually from their home. That's a federally approved situation. They have to apply for that and have federal approval for that leave based on their circumstances, their health issues. And for that to kind of turn up red when it's something that's been federally approved makes it look like it's a problem when it's really something that's out of the local's control and is federally approved and allowable for those teachers who might still be teaching, 100% from home. And I share Ms. Morrow's concern about the fact that we have all of this reporting on athletics and no mention at all of other extracurriculars. And I know that there are too many to individually look at them, and I understand that 100%, but just like we have students who are looking for athletic scholarship and need to have their film and things like that to get their athletics, we have students who are going for academic scholarships, and when they look at academic scholarships, they're looking at their involvement in leadership activities, in service organizations, and in some of these other extracurriculars, which we don't seem to be addressing it at all. And it is of concern to those students who are looking to have that high level of rounded experiences in order to earn academic or music or those types of scholarships. And I guess that kind of sums up where my concerns are. I just want to make sure we don't want it to look punitive for things that are out of locals' control, And I don't want to leave out those kids that have other extracurricular needs outside of athletics.
I think both those points are excellent points that we should look at how we can include, either not include or include. And that's really what this discussion is for. So it's great you brought that up.
Thank you. Senator Bates?
Thank you. You're going into a tremendous amount of detail here, and I hope we don't end up with so much detail that we lose sight of the big picture. So that is a concern to me. Another concern, I see you've got a tremendous amount of breakdown across racial lines and whatever for all the students. You had a number of factors in here, but yet I don't see a breakdown by like elementary, middle, high school, which you might be able to do more synchronous, async, whatever, based on, and maybe the quality of the different kind of training would be different at those different grade levels. I don't really see a breakdown here with respect to that. I think socialization is very important at different levels, and a lot of times children learn from each other, and it seems that it's not as troublesome for younger children to be in a classroom at this point, but maybe so. Again, I like what you're doing. I understand. I hope we don't just overwhelm people and inundate them with data to the point where nobody's going to look at it. But I also want to see some breakdown with age range, basically, so thank you very much. I appreciate all the work that's going into it.
Thank you, Senator. Ms. Alley?
This is a really difficult data point because I understand that neither the department nor the board have expertise in this area. But one of the concerns in terms of going back to school has to do with ventilation. And I'm wondering if there's any way for us to get information. I think I've seen some different news reports about schools assessing their physical plants and what monies they might need to improve their ventilation systems. But if we could do some kind of reporting, and I think it would even be helpful in consultation with experts, if we set some guidance about what we're looking for in terms of spaces that students and teachers occupy, what the airflow is or the purification. I'm not, it's out of my area of expertise, but there may be rooms in a building that are qualified and other rooms that don't have proper ventilation. And we know that many of our schools, we can't open the windows. So that's one comment. And then the other comment is really a question. When we got the earlier part, Dr. Williamson, in terms of, pardon my dog, the joys of Zoom. In terms of the status of school opening, we had 3 systems that had TBD. Can you offer any more insight in terms of why those systems are delayed in their response here?
I believe Mary is the one that's going to have the most information about that, about the 3. Yes?
Yes, I'm sorry. I'm quickly getting to, yes, in some cases, when we asked, there were board meetings just the day before a decision had not been announced, or a board meeting that night, or a board meeting the next day. So in the one case, Baltimore County, that was TBD, working on details of returning students. That particular one was right around the board meeting time. Charles County, the same way, no addition, and you can see the note, the board is meeting right now. And Frederick also. So Frederick had recently made a decision to stay virtual. And so that was the information. We did go back actually to a number, and Dr. Williamson was the one that was reaching out to the assistant soups to try to gather some additional information, and some of them responded to us and some of them didn't. So, you always get a date of which we go out. We are on a continual update of this information, and we will continue to work to do that for you. If I can just add one more comment, and this is an answer to, I think it was Senator Bates. The last question is the question that is disaggregated. And I know there's a lot of data on here. It's by category. So it's elementary, and it's all elementary, disaggregated, middle, all disaggregated, high school, and then combined. So that's the only question where we disaggregated them, and it is by elementary, middle, and high. There are not other questions that we broke down. I just wanted to clarify that for you, Senator Bates.
Okay, so thank you. And I think we have Ms. McCusker and then Dr. Lee. Ms. McCusker.
Thank you, and I'm sorry, I missed something in my notes, and I did want to, they did, the day after you gathered all of this information, Carroll changed theirs. We don't have all students in. They changed it to have just elementary and middle schools. And it was literally the day after you compiled the information.
That's right.
So I think that's the kind of thing that's going to change constantly on you as boards meet. But there was one indicator, and as I was looking at my notes, I looked over it, and I didn't mean to look over. I meant to ask something about it. When we talk about the percentage of teachers in buildings that are teaching students face-to-face and virtually at the same time. There's been a lot of discussion about that, a lot of mention of it this morning, and it's on here in a way that we're saying that's a good thing. I think that, we've only been doing it at my school for a week, and, right now we're not so sure. We feel like we don't really give either group our full attention. Do we have any data to support that, yes, this is in fact a good thing, and we are going to be able to train teachers to do it more efficiently? So I had a little concern with that, because I'm not sure that we've been doing it long enough to know whether or not it's a positive or a negative just yet. But that was just another concern I wanted to share, because I know that in the week that we've been doing it, at least on the elementary level, we feel like it almost splits us to the point that neither one really gets our best.
So, Ms. McCusker, you bring up the very point that I made earlier, in the fact that we need to make sure that what we're capturing is the right data based on whatever the definitions are. And there may need to be another category, as we were talking about the different ways that we're providing that hybrid instruction. And I'll just share one thing, and that was when I was in Cecil County. You just finished 1 week. The teachers in Cecil County said the first week was really, really hard, but the second week was a lot easier. So I'm hopeful that your second week will be a lot easier. But we really need to make sure we're measuring all the things that we can measure, and not saying one is better than the other, because there is no research to support that yet. And maybe that'll be something we look at in the years to come. But I think you make a good point there.
Thank you. And another thing that also is happening is some counties are allowing students to access whenever they like. So we may never see them face to face. They're allowing students to just access recordings. Like in Carroll, I have to record all of my lessons so that students that are accessing it on the weekends or whenever their families can do it with their daycare arrangements. So that's just another layer that gets added in, that there's some students we don't even see virtually, that they're completely invisible, and we can only gauge their attendance and their progress instructionally by what they turn in, because we don't ever see them.
Dr. McCarthy, thank you, Ms. McCusker.
So this is such a rich discussion, and there's a lot of work putting this together. Thank you. I want to go back to a point on ventilation. Ventilation is quite expensive, and when we talk about ventilation, we're talking about the health and safety of children. And there are children in schools that are non-public schools, that are in independent schools. And to create funding for ventilation for students only in public schools is quite an inequity and quite an affront to safety for all children. So I just wanted to put that little peg in to remind people that children are in schools all over the state, private and public. And when we talk about things that are of utmost safety concerns, we need to consider all children. Thanks.
Dr. Melanie McCarthy, I want to just put an exclamation point on what you just said. I also want to let you know that I'm currently having discussions with the other group of people I chair, the interagency school construction program, about this very issue. There was a great article that was in the Harvard Gazette not too long ago with one of the experts in this area. And so we're having that reviewed as we speak. And I want to also say that he was able to articulate some very low-cost measures to improve ventilation, and not that we would be having to change HVAC systems. And of course, one of the most lowest cost is to open the window 3 or 4 inches. So we'll be trying to get back to you on that because it's a great point. And but thank you for mentioning our partners out there who I believe have been doing a tremendous job during the pandemic in providing the in-person instruction. Again, want to celebrate their successes. Thank you.
Thank you. I think we have Dr. Getty and then Dr. Lee.
I know that this is a highly controversial issue, what I'm about to say, but under the infection rate, if I was a parent, the thing that I would most want to know is how many students have tested positive and how many faculty and staff and other adults have tested positive. I know that our local health department is saying that that will not be reported. Can somebody talk about why that would or would not be included?
Thanks for that question, Dr. Getty. That's a really good one and timely, because one of the things that Dr. Chan and I, the deputy at the Maryland Department of Health, have been working on is how we will report outbreaks. And let me explain that it's very difficult, some of these terms, so I like to try to explain them when I do understand them myself. And that is, an outbreak is considered to be, and this is in our metrics and guideposts on the website. An outbreak is when you have 2 or more related cases in a school, let's say. So let me see if I can provide an example. If you have 2 students or 2 staff people that have been in the same proximity, that would be an outbreak. If you have a staff person that has had no contact with a particular student that has been symptomatic in another classroom and has had no contact, that would not be considered an outbreak. So right now, the health department is working on what they might call a dashboard for how these will be reported, and we will be reporting these on a statewide basis in the very near future. I'm hopeful, like maybe next week, but I don't want to put any pressure on the Maryland Department of Health because this is their dashboard. But I also know from experience that the local school systems in some of the counties are reporting cases, and they've been in the newspaper. So I think there'll be a statewide level of transparency, and then there'll probably be a local level in terms of transparency as well. So you bring up a good point, and I think we're going to have that information.
Okay, we've got still have an opportunity. I'd like to wrap this up. We have 2 other items, and you're free to send comments to Dr. Salmon. Additional comments, Dr. Lee.
Thank you. I might have missed this in the beginning, but I wanted to make sure that there was a very clear, well-defined time period for which these responses are going to be collected. And I'm assuming it'll be by grading period. So just wanted to clarify that. And then the other piece that I thought might be important to just note is for PPEs, whether they're working touchless thermometers that everybody should have, and that they should, all be in working order and they have that available. The second point I wanted to make is to reinforce again the importance placed on the extracurriculars. And I have not heard a lot of attention being given to tournaments. There are state-sponsored, county-sponsored tournaments and events that the different students compete in, and that opportunity, I think, needs to be encouraged, as others have said, because these are leadership opportunities for a vast majority of the students in the system. The last point I wanted to make sure to point out is in the first term performance metrics, there's questions about making sure that teachers and principals have received training on effective distance learning practices and staff have received training on appropriate health, hygiene, and cleaning procedures. I don't know if it's possible to set some guidelines about basically requiring that this all be in place as soon as possible by a certain date, and not be collecting a percent of it, because it's really trying to get people to 100%. And also, I think it's important to provide, maybe it doesn't have to be training so much as guidance to staff, but also teachers about the health and hygiene cleaning procedures that are being used in their classrooms, so that they're educated about that. And I'm sure many teachers, I have people in my company that take it upon themselves to want to clean things, to to reinforce what's already being done, because there are concerns about, was it cleaned well enough, did they catch this and things like that, but to educate everybody and not leave out such an important component of the population that occupies the schools.
Dr. Luke, just a couple of responses, because you always think about the details, and I appreciate the thoroughness with which you review our materials. And I do think we were thinking about a quarterly reporting of these data, because we put the first term metrics in there. So I think that makes a lot of sense. And then in terms of the cleaning protocols, I totally agree. I mean, it should be 100%. We have put out what the protocols need to be, and I know that our safety folks in the schools are very, very attentive to this. And I think President Crawford and I got to see some cleaning in the works as we were visiting schools. So I do think you make good points, and we'll make sure that the requirements are there. I think you're right about a percentage is not acceptable, and we'll rework that. Thank you again.
And to Senator Bates's point, these questions, a lot of them won't reappear, right? Because it's only a one-time question to get them onto, same starting point, right?
At this time, and again, if you have additional comments or questions, please feel free to send them to us and to Ms. Haley and myself, and Dr. Sam will get them in. Given the time, what I'd like to do, Dr. Sam, is it possible to do one of the two remaining items and push the other one till tomorrow, or what do you think? Can we do it quickly?
Yeah, President Crawford, I think it would be good, because it would be good to revisit tomorrow about the funding. So let's move the CARES Act funding till tomorrow, and let's make sure we cover the waiver request that I have asked the board to consider with regard to the September 30th enrollment. So if we could do that, I would be appreciative of that.
Okay. Then we will make that adjustment in the schedule. So we're going to do the waiver now, Dr. Salmon?
Yes, thank you, President Crawford. We have been concerned about the September 30 enrollment for a number of reasons, for a number of months, because in our regulations, there is a relationship stated between school attendance and the students being immunized for all of the things they need to be. And we were concerned that this may be a problem given COVID, getting some of these things done before students would come to school. And there are a number of systems that are not going to have students physically in school until the first of the year, unless they decide to bring some back. And I've been assured by this superintendents that they will do everything possible to make sure the students have their appropriate vaccinations before they physically enter the building. So in order not to penalize school systems for lower attendance in the coming year, which would impact their state aid the following year, we'd like to propose this waiver, which we have shared with the Maryland Department of Health, and they have agreed that this waiver is okay with them. And so I'd like to get your permission, and I'm going to let Ms. Gable present this to you now. Thank you.
I'm coming back. At this time, this waiver, as Dr. Salmon has really explained, this is a waiver for counting the student for the count only. It is not for not requiring immunization when the student returns. But for all of the reasons that Dr. Salmon has given, it allows, based on your approval of the waiver, for students to be counted. Many parents have tried to schedule appointments. They have been concerned, one, about taking their children, as we understand. Two, given so many, in cases at times, the appointments have had to be canceled. And three, they've had difficulty just scheduling them. So given the challenge with parents, it's not for lack of trying. It is also important, as Dr. Salmon said about talking to the Department of Health, this is not the time that we do not want students immunized, but we do not want to penalize the school systems for these difficult times. So this is a request that the waiver would cover for the purpose of counting students in this count for funding, that the student could be waived. However, when a student returns to school, the immunization would need to be there. Based on that, the request for a waiver, and I don't have the number right in front of me, but I do have it, is a request to the state board for a waiver of the requirement that the auditing looks for in order to count a student September 30th for funding.
So we have before us a request for a waiver, and in effect, what it allows the local school systems to do would be to count all of the students. Students would still be required to have immunizations before they return to class. But what this is an accounting measure that would lessen the impact of undercount and the impact on funding starting next school year, right? So it'd be next school year is when they would feel the effect of this. So it doesn't change the immunization requirement. It's only for this one time. And it's part of a strategy to try to the extent we can, hold the schools harmless with respect to funding. Ms. Haley.
I move that we approve the waiver.
Second, Lori Moore.
There has been motion has been made by Ms. Haley and the seconded by I'm sorry. Ms. Morrow. Yep. Okay. It's been now discussion. Dr. Lee.
I'm supportive of this, but I feel like it's a question in my mind. Are we going to change the date by which schools are supposed to prove immunizations? Because it's not clear to me whether we are letting that slide. And I think it's still important to have a date as an operating principle, even if you want to postpone the date, December 1st, March something, or what's the incentive to do this for the schools?
There is no real date because the count is September 30th. So what school systems would, if we don't have this waiver, school systems would not be able to count any student right now or back to September 30th that did not have their immunization up to date. What we're asking is that and it could vary because some school systems will come back hopefully before the second semester. But what the superintendents have agreed to is that when students are physically back in the buildings, and that could vary depending on when in-person starts, they will have to have their immunizations to keep people safe in the school.
Right. Okay. Thank you.
Any additional discussion? Seeing no additional discussion is necessary, can you help us with a quick roll call vote?
Yes, I can.
Thank you.
Can you hear me?
Yes.
Mr. Bartley?
Aye.
Ms. Bates?
Aye.
Mr. Crawford?
Aye.
Mr. Dashiell?
Aye.
Dr. Getty,
Aye.
Dr. Green,
Dr. Green had to leave early.
okay. Ms. Haley,
Aye.
Dr. Lee,
Aye.
Ms. McCusker,
Aye.
Dr. Malia McCarthy,
Aye.
Ms. Morrow,
Aye.
General Sumter,
Aye.
Dr. Wilcox,
Aye.
and Mr. Will.
Aye.
The motion passed unanimously.
Excellent. Okay. At this time, what we will do, we will amend the agenda for tomorrow to pick up the coronavirus relief funding as part of our discussion for tomorrow. We will reconvene on tomorrow. I'm just trying to, as you get older, you sometimes get a little confused. Just want to make sure I'm saying it right. Okay, we reconvene at 9:30. Again, thank you very much. I'd like to entertain a motion to adjourn. Ms. Haley?
Second.
Senator Bates, second. It was Senator Bates. Raise her hand. She's second. Any discussion? Seeing no discussion, we'll do this by voice vote. All in favor of adjournment, say aye.
Aye. John Bartley says aye.
Opposed? Abstentions? Excellent. See you tomorrow, 9:30. Thank you very much. Great conversation, great discussion.
Thank you.
Thank you.
Thanks, everyone.